When we have patients taking oral estrogen, probably the best monitoring tool for evaluating the dose is probably serum testing. Saliva testing can work as well. And then urine testing is going to be really used best in this situation for monitoring the metabolism of estrogen, but not as well for monitoring the dosing. So when we're looking at serum testing, the serum levels following a dose of estrogen is going to increase. And once you've been on the supplement for a while, the up and down pattern throughout the day, as you can see from this study here, they go up, the levels go up and down relatively slowly. And that's a nice thing because it allows you to test at 8 hours, at 12 hours, at 16 hours after the dose and get a reasonably similar value so you can effectively monitor the dose. Probably about the same pattern you're going to see in saliva. The biggest downside there is simply that it's easier to get an accurate look at estrogen in blood because there's just so much more there. You can see from some of our other videos where we're looking at the simple measurement of reproductive hormones that serum's probably a better test just in terms of analytical accuracy, but how much hormone is in your blood and in your saliva when you take oral estrogen is probably pretty representative of what's going on systemically. So it should work reasonably well. Now, when you look at urine testing, we have some information that serum testing and saliva testing doesn't have that's really effective, especially with oral estrogen. We want to look at the metabolism. Are you preferentially making 16-hydroxyestrogens, which are more potent, 4-hydroxyestrogens, which are potentially carcinogenic, or the 2-hydroxyestrogens, which are thought to be more protective? We want to look at that relative distribution, and that's important. That's phase 1 metabolism. We can also look at methylation, which is also an important step in the metabolism of estrogen. Here's where we run into trouble, and that is monitoring dosing. Is my dose effective? That's probably better asked with serum or saliva testing, and here's why. When I take estrogen orally, it goes into my gut. In the gut, before it's gotten into circulation, a lot of it is metabolized or conjugated. Now, a conjugate of that estrogen, that's what we look at in urine. So estradiol, which is your primary estrogen, that's probably what you're taking, gets turned into what? Estradiol glucuronide, and that ends up in your urine. Now, when you're not taking estrogen, this is a really good measurement to reflect how much bioavailable estradiol you have, and we've shown that that correlates really well with serum estradiol. However, when you take it orally, and that estrogen conjugate, that estradiol glucuronide, gets made in your gut and gets put into the urine, that hormone's never been in circulation as a free bioavailable hormone. Now, some of the hormone escapes the gut. That's why we take it. It escapes the gut and gets into circulation as estradiol. Then it gets turned into the form that's excreted, that glucuronide conjugate, and that ends up in the urine. So you get the conjugates from first pass metabolism, which sort of don't count, and then the ones that come from the circulating estrogen that you get from your supplement. And so you get this mix of values, and we can't differentiate which one is which, so you essentially get falsely elevated values specifically in the urine, and if you're going to use that to monitor dosing, it's not going to be that effective. So what we have patients do is we have them skip that dose the day of the test. That's going to eliminate a lot of those first pass metabolites. And we've seen from the serum testing that if you wait 24 hours, guess what? The circulating estrogen levels are still relatively high. So looking at those estrogen values in urine the day after the last dose is probably the best way to go. But you still have a chance to potentially have some of those first pass metabolites in your results as they sort of clear out of your system. And so you can get essentially falsely elevated values. So if I take estradiol and my urinary value of estradiol is elevated, it doesn't necessarily mean that you're taking too much estrogen. It could just be from first pass metabolites. So you've got to be a little bit careful when you're evaluating oral estrogen in terms of the dosing using urine testing. Again, the best way to do it is probably to skip it the day of the test, and then you can use it to some degree, but again, it can be somewhat ambiguous as to whether the dosing is effective or not. So use the urine testing primarily for monitoring the metabolites. And if you need a better value in terms of monitoring dosing, probably blood testing or serum testing of estradiol is going to be the most effective way to do that. When you're looking at hormones like DHEA taken orally, skipping the dose for a day seems to be a good way to do that, and then looking at the urine metabolites. The first pass metabolites are mostly passed through, and then you're going to get a good look at not only how much DHEA is hanging around, but also how is it then being metabolized, which is information you can only see in the urine test. Am I making those more active alpha metabolites? Is it passing down the more less active beta pathway? You can look at some of those things when you're taking DHEA orally, and that's a pretty effective way to test. Serum and saliva testing can also be effective when you're taking oral DHEA. Now remember, when monitoring oral progesterone, the rules for testing are very different. Serum and saliva testing are not effective for that, and you can watch our other video on oral progesterone to get the details on that. But keep in mind that that's a little bit different than when you're looking at either estrogen or DHEA or other hormones that are taken orally.